with us in the chat.
Okay, well, I think let's go ahead and get started. To welcome everybody to this webinar. We're really excited to have everyone here, as that is part of our big coalition effort to pass hundreds of local resolutions in support of Medicare for All. My name is Melinda St. Louis, and I'm the Medicare for All campaign director at Public Citizen. And we've joined together with many powerful organizations in this Medicare for All movement to pass this local resolutions campaign, because we all believe strongly that healthcare is a human right. And we're really excited tonight to have teamed up with Dr. Bill Honigman and the Progressive Democrats of America, Healthcare is a Human Right Working Group, for tonight's webinar. So Dr. Bill, if you want to say some words of welcome too, that would be great.
Yes. Thank you so much, Melinda and Brittany. You guys are amazing. What an awesome team on Medicare for All resolutions. And this perfectly fits with the work that we do in PDA. And this is our regular meeting hour, the second Wednesday of the month. And we invite you all to join us if you're new to PDA, Progressive Democrats America, and People Demanding Action, our issue team. We'll go over that in some detail a little bit later, but we've gone to the Zoom meeting format here, which affords opportunity for kind of visual interface as well. The meeting will be recorded, right, Melinda? So folks
yes, it's being recorded right now.
Yeah, and we'll float the link for the recording out there in the interwebs, so folks can watch later if you can't stick with us the entire time. And sorry, you can't. We can't unmute you. You can't, unfortunately. Big panel, big group of folks, but we will try to keep up in the chat function on Zoom. So another good reason to join us on Zoom in the computer format, so we can keep up in the chat. Otherwise, you'll be able to contact us independently. So again, welcome to the call. Thank you so much, Melinda. And we're going to go right to the agenda. Correct?
Yes, we have a very a full agenda. So I want to begin by saying that one of the things that we know is really important as we do all of our healthcare justice work is that we know we need to work in solidarity across movements. And we've been reminded, particularly at this moment, after the mass shooting in El Paso and the ICE raid of over 600 immigrant workers in Mississippi, that it's really important that we understand the intersections between healthcare justice and immigrant justice movements. So we're very lucky tonight to hear from leaders in that movement, including Sofia Sepulveda from the Texas Organizing Project, and we will be joined by Sanaa, Abrar from United We Dream, which is a new partner in this campaign, our resolutions campaign, to talk about that in this tonight's call. We'll also be joined by later by Congressman Jamie Raskin from Maryland, which is very exciting. He's a powerful champion for Medicare for All on Capitol Hill, to share his thoughts about what we can expect after the August recess on this issue. And we're thrilled we'll be joined by Marti, Garza, who leads the healthcare department at the Machinists Union, which is very exciting, a really powerful partner. And we have Kelly Coogan-Gehr from the National Nurses United, and powerful local leaders from PDA and other organizations all around the country who are mobilizing for resolutions and elsewhere. So as Dr. Bill said, you can feel free to write questions in this chat box along the way, and we will give our emails if you have other questions, and you can email us later as well. And Mike PDA is going to be helping us coordinating some of the responses and panelists. So I want to kick it off with so Sanaa hasn't joined us yet, so I think we'll begin with Sofia. If you could begin with. I'm so sorry. I just realized I wanted to kick it off first with Brittany from Public Citizen to just give a quick update of where we are with the on the resolutions campaign, and then we will jump in to the rest of the agenda. So go ahead, Brittany.
Yeah, everybody. Cool. Hi, everyone. So we are definitely having a back to school frenzy for resolutions in August. On Monday, the city of Carpinteria, California, passed a resolution for Medicare for all. Next week, there will be hearings for resolutions in Birmingham, Alabama, and Norristown, Pennsylvania. We have information on these upcoming events and other upcoming events on our website. So I'm going to show you quickly how to find them. Let me share a screen, new tab. I'm going to www.medicareforallresolutions.org. And then I'm clicking on Take Action in Your Town, Find Your Town. Here's our map. So you can either use the red icons indicate that there's an event going on, or you can just come down here. So this is where we have the upcoming hearing information. So if I click on Norristown, it has the address, it has information about accessibility, and it has a link to Facebook and a link to email the local organizers to let them know you're going or if you have any questions. So that's the website. So something that I am really, really excited about is that both of the cities I just mentioned, Birmingham and Norristown, are in districts belonging to Congresswomen who have not signed on as co-sponsors to H.R. 1384, the Medicare for All Act of 2019. So that's Representatives Terry Sewell in Birmingham and Madeline Dean in Pennsylvania. Passing a resolution is a great opportunity to show your congressperson that the people who live in their district need them to show leadership by signing on to the bill in Congress. Behind the scenes, the organizing for resolutions has really ramped it up. In the last month, we've had regional coalition calls with activists in San Diego, Southeast Florida, and Hudson Valley, New York. We're planning more regional calls for Dallas, Fort Worth, and the Harris County / Houston / little corner of the Gulf Coast in Texas. So I'm really, really excited to be doing things in Texas, and also to hear some of the work that Sofia's been doing in a bit. And the wheels are also turning really fast in Baltimore, Tucson, Denver, Boulder, and other cities where we expect to see resolutions introduced very, very soon. I'm also excited that we will be working on resolutions with medical students on campuses in college towns across the country this fall. As always, feel free to get in touch if you have any questions about the campaign. It has been truly inspiring to work with you this summer, and I'm excited for the big things ahead of us as we move into the fall.
Great, thank you so much, Brittany. Now I would like to turn it over to Sofia Sepulveda from the Texas Organizing Project to share some of the work that you've been organizing in Latinx communities in Texas and elsewhere. I think we have you, you're on mute, so unmute yourself.
There you go.
There you go.
Hello, everybody, and thank you for joining us in the Medicare for All resolutions. So we've been working on Medicare for the last 3 years. We were the force behind getting Lloyd Doggett to sign into the H.R. 1384, which we're super proud about that. We haven't done any Medicare for All resolutions as of yet because our city council just returned from vacation, so we're starting having the meetings with them. We identified 3 champions. Also, during the city council elections, we were able to pose that question to everybody who wanted to have an endorsement from our organization. Do you support Medicare for All? So we were able also to identify 7 folks within city council. It's a city council of 10 people who are supporting Medicare for All. And therefore, we have an in already with our city council in order to start not just talking, but put the resolutions for a vote, hopefully soon before the end of the year. We've, like Melinda was saying, been working, and Brittany, we were working on low-income communities, especially brown and Black communities, and we discovered there was a lot of healthcare needs within the communities. A lot of immigrants, folks do not have access to dialysis, even though they can go to a local healthcare system here in San Antonio. So we identify those things as a way to start pushing for the Medicare resolution and to start pushing for a Medicare for All within our city council, which now there are finally catching on to the fact that it's our community, the ones who is more needing for healthcare in San Antonio. And so, like I said, we started last year, 3 years ago. Last year, started working with TOP. We grew from 10 folks to 50 folks right now in Healthcare San Antonio alone. And so we're super, super proud to start doing this work with not just Public Citizen, but National Nurses United, PDA, Our Revolution, the DSA. We partner up with them in Austin in order to put to keep on pushing for Dogged to sign on for Medicare for All. So that's what we're doing. We are mounting a statewide campaign as well with Houston and Dallas in order to start pushing also not just for the Medicare for All resolutions, but to ensure that comes 2021, our Texas legislative session, Medicare for All and healthcare will be the #1 issue for our representatives to start talking about.
Thank you so much, Sofia. That's extremely helpful and a really important report, and thank you so much. I think we will move on to Marti right now, who is Marti Garza, who's the director of the healthcare department from the International Association of Machinists and Aerospace Workers, to share a bit about how unions are getting involved in this fight. So I'll turn it over to you, Marti.
Thank you. I'm happy to be on the webinar. So I'm with the Machinists Union. We are a supporter of Medicare for All. Just to very quickly, we're an industrial union. A lot of our folks work in not traditionally a healthcare setting, but everyone realizes in our union that the only way to alleviate some of the pressures that working men and women have in terms of when it comes to bargaining for our contracts at the bargaining table, that Medicare for All is sort of the right way to go. And so we at our district and state councils, so these are gatherings of machinist leaders, we're moving internal resolutions so that not only do we support Medicare for All at the national level, but at the state and municipal level. And I would encourage everyone here who has yet to reach out to the labor community to think about reaching out to the labor community and seeing where you might plug in. Our particular union has locals across the country, most urban areas. Particularly, we have good presence in the South and Southwest, which are not particularly thought of as, union-heavy states. So that's somewhere where I feel like we can add a lot of value and work in coalition with other organizations and individuals. Not an insignificant amount of our members are also DSA members who are supportive of Medicare for All. And so I just want to extend an invitation to folks on the call here. If you want to collaborate with some of our union rank and file members that are interested in getting involved on Medicare for All, to reach out to them. We often have connections with municipal and or county legislators, elected officials, will have some experience bringing things to the table, resources like meeting places, in-kind, resources like being able to make copies, that type of stuff. It's just a wealth of informal resource that, again, like I say, we would be happy to bring to work in coalition with folks on the Medicare for All issue.
Thank you. Thank you so much, Marti. Do we have Representative Raskin on the line? Is that Representative Bill Raskin, Jamie Raskin?
This is Martha with Congressman Raskin's office. I'm going to check his, working with him on his connection, so please hold.
Okay. So we're trying to connect Representative Raskin in to the call. Perhaps we could, Dr. Bill, if you would like to maybe give your overview until we get Representative Raskin on the line.
Sure. Okay. Can you hear me all right?
Yeah.
Okay, great. Thanks. So let's see. I'm going to do a little screen share. If that works. Where is it? share. Okay, are you seeing that?
Yes, we can see it.
Okay, cool. So, so just kind of by way of, let's see, there we go, full screen. Just by way of updates, and again, for those who may not be familiar with what we do at PDA, this is our usual Wednesday night conference call, now a Zoom meeting, the second Wednesday of every month, and we are the PDA Healthcare Human Rights Issue Team, and that comes from our history. PDA was formed in 2004 after the Democratic Convention nominated someone for president that we all felt was not really a progressive by any means, and lots of folks were working for other candidates for president that year. So we formed Progressive Democrats America back then, 15 years ago. Now, subsequently, we actually have two groups within PDA. Progressive Democrats America, you can go to the website pdamerican.org, and also now with Issues, Issues team that's referred to as People Demanding Action. So they're both PDA. One is PD America, the other one is PD Action, and on the issue side is where we discuss healthcare human rights. We have amazing intersectional other teams such as End Corporate Rule, Economic and Social Justice, Equal Rights Amendment Working Group. So by all means, check out our websites and jump on the other team calls and meetings that you see listed there. In terms of our work for Medicare for All, most of our work is especially done with our coalition partners, who are, lots of them are on the call tonight, and all the other webinars that we've done now with Medicare for All resolutions, including NNU, PNHP, Healthcare Now, the Labor Campaign for Single Payer, what's known as the One Payer States Group. And if you don't know about that, by all means, feel free to contact me. But uniquely, PDA does something we call a letter drop, where once a month we drop letters on members of the Congress in their offices, both at the district and Capitol Hill areas. And we back that up with our virtual phone bank and have constituent members of PDA call in to those members of Congress and say, we support HR 1384, S1129, which is, of course, our national Medicare for All bills, and the one that you should see reintroduced soon, the state-based universal health care bill. So that is keeping pressure on those members of Congress, or we might say supporting them to support us by supporting our issues. Also, of course, we're working in partnership on the barnstorms with people's assemblies, forums, and movie showings. Excellent Fix-It healthcare movie, by all means, I recommend the folks in Helena, Montana, who are wondering how we're going to pay for all this. They do a great job with that Fix-It healthcare movie. Again, happy to give you a link for that. On the PD America side, which is our electoral side of PDA, we work on promoting candidates all the way from the local up to the federal level. We do have state PACs in many states now. And so we're working to promote candidates who get it, who understand the incredible savings, the fact that we'll save money and save lives with Medicare for All. And then that leads us back to this work in Medicare for All resolutions, because we know school board members, as well as city council and county council members, need to get that, how much money it's going to save, how it's going to benefit the communities all the way from the bottom up. So again, if you'd like more information, like to get more involved with PDA, by all means, contact the incredible Mike Fox at pdamerica.org, or myself, Dr. Bill at pdamerica.org, to develop a chapter in your area. We're going to hear from some chapter folks in PDA just in a little while here to give some reports. Our letter droppers, our virtual phone bank, Mike Fox will put you to work tomorrow making it all important phone calls. So just contact us at PDA. Thank you, Melinda.
Great. Thanks so much. Do we have Representative Raskin on the line?
Yes, forgive me. I've been on the line kind of stalking everybody here, but yes, I am on the line.
Oh, okay, great. Well, we're really, really grateful to have Representative Jamie Raskin from Maryland's 8th District on the line with us. He's an incredible champion for Medicare for All and many progressive causes, and is also on the important Rules Committee that held the first hearing on Medicare for All. So we're really excited to hear from you, your update from Capitol Hill around Medicare for All and how our Medicare for All resolutions can support that.
Well, look, thank you so much for having me, everybody. And I'm delighted that you guys are working all the way through the summer and in the dog days of August and everything. I know that we continue to pick up support for Medicare for All. And I think that, you know, we're building tremendous momentum. You know, everything is pointing in our direction. You know, I'm of the mind that at this point, we need to really be advancing the values that underlie the system. Because, you know, there's a lot of different proposals and variations out there, and all of that is fine and good. And I think, you know, there will be a point at which we've got to make some crucial policy judgments. But I think at this point, the major thing is to convince everybody in Congress that we can, and convince the public that Medicare for All stands up for the value which motivates most of the American people, which is that in the wealthiest society that's ever existed, at its wealthiest moment, we can afford to have health care for everybody, and it's the only system that actually works when you look around the world. Obviously, there are going to be logistical questions and practical questions about how we get from here to there, but we have to let people know that we are on the side of making sure that there will be health care for all of the American people. And it's just scandalous. There's still tens of millions of Americans who have no health care, and there are tens of millions of Americans who have health insurance but can't get the coverage that they need once they get sick because of the extremely high deductibles and co-pays and, you know, the various booby traps that are built into the system. I think it was Winston Churchill who said that you can always count on the Americans to do the right thing once they've tried everything else. And we've pretty much tried everything else at this point. So I think that we're going to get there to Medicare for All, but we have to continue to advance the basic values, which I do think unite Americans across the political spectrum.
Thank you so much, Congressman Raskin. We're again, and we thank you so much for your leadership. There have been many folks on the chat. We're putting on the webinar, thanking you for the questions and the personal testimony that you gave during the rules hearing, and you know, we're really grateful for that, and we're looking forward to continuing the big push both at the very grassroots level to get local officials to pressure members of Congress to sign on to the bill if they haven't, and to become greater champions. So thank you so much for your leadership.
Well, again, it's my pleasure to work with all of you, and we had a really fantastic first hearing. I think people were amazed at how well developed the plans are, but also were moved by the remarkable testimony we had from the witnesses there and from people around the country. And certainly, you know, my experience with cancer taught me that you know, when you go through something that is so emotionally and psychologically and existentially draining and overwhelming for you and your family, the last thing that we would want to force anybody to do is to be in a situation where they couldn't afford it or they didn't know where their insurance was coming from. So for me, this is a very basic commitment, and I'm just excited that the movement is so well organized and we continue to pick up so much steam every single day.
Thank you so much. We very much appreciate it. We will continue the fight. So now, Dr. Bill, if you want to turn it over to the second half of our agenda, that would be great.
Sure, thank you. Thanks so much, Representative Raskin. I know you're considered to be a hero by so many people in PDA land, that's for sure. So thank you for all the tremendous work that you're doing, holding other government officials accountable, which is, is huge for us as well. So, and thank you especially for your help in this fight for healthcare justice. Speaking of heroes in the fight for healthcare justice, I'm honored and pleased to bring on Kelly Coogan-Gehr, who's with National Nurses United and have been such champions for the cause. So, Kelly, would you like to give us an update from NNU, please?
Yeah, thanks so much, Dr. Bill. Can folks hear me okay?
Mm-hmm. Yep.
Absolutely.
So in concert with grassroots activists across the country and with many of the organizations that are on this call tonight, we came up with a strategy to dial up pressure on Congress, on Medicare for All during the August recess. And I am so happy to say that it's working. Several of you who got on this call probably also got on a call that we had in late June where we called on activists across the country in districts with reps who have not yet co-sponsored HR 13 to host what we decided to call a People's Assembly on Medicare for All in their community. And the idea was that at these events, folks would gather with their neighbors, they would talk about why we need Medicare for All, they would talk in a really specific way about why their rep has not signed on, and they would start planning a next escalating action and next steps to get their reps on board. So again, the idea was to ramp up pressure while Congress is home and reps are more likely to feel the heat. And we have to thank Indivisible, who did such a great job organizing using a strategy like this around the August recess in 2017. A lot of volunteers responded to the call to action. We now have a total of 52 volunteer-led events in congressional districts of mostly Democrats who have not yet co-sponsored HR 13 and given that only a little over 100 Democrats haven't co-sponsored yet, to have events and local organizing take place in over half of their districts is absolutely a huge feat, particularly in August when folks are on vacations and stuff like this. Most of these events have already taken place. As the August recess, most of you know, began on July 29th. 41 have already happened. 11 more across the country are taking place in the next few weeks. There possibly is an upcoming one near you. You can easily go find out by going to www.medicare4all.org/actions. And just a few quick highlights on some notable events. I imagine that others on the call will talk about some events, but we had just last Thursday over 150 attendees in Brooklyn, New York, to build pressure on Rep. Hakeem Jeffries, who's crucially important as the chair, of the House Democratic Caucus. They're going to be canvassing and doing district office visit with Jeffries. We had 50 attendees in Long Branch, New Jersey at a People's Assembly to build pressure on none other than Rep. Frank Pallone, who's crucially important as the chair of the Energy and Commerce Committee. They are going to be holding a rally on September 15th and packing Frank Pallone's town hall tomorrow night with supporters. So any of you who call from New Jersey, please be on the lookout for that. We had 50 attendees in San Diego, California to build pressure on Rep. Scott Peters, a crucially important member of the Energy and Commerce Committee. There's going to be a big meeting with him next Wednesday. We had 70 attendees at a People's Assembly in Sacramento, California to build pressure on Doris Mitsui, another crucially important member of the Energy and Commerce Committee. They are holding a rally in Sacramento on August 27th outside of her office. And just one last event I'm going to mention, 40 attendees in Tampa, Florida to build pressure on Rep. Kathy Castor, another crucially important member of Energy and Commerce. They are going to hold in Tampa, Florida, a rally on August the 23rd outside of her office. And again, for those of you on our call, you know that part of the escalating strategy right now is really keying in on those members of Energy and Commerce, because that's likely the next place where the bill is going to get a hearing. So just really quickly, a couple final things. Alongside this action, we wanted to make sure we had a really big tent plan that included everybody. So folks who are in districts of reps who have already co-sponsored, they are also organizing in solidarity text bank parties in their communities to get volunteers and text thousands of voters in key districts of voters in the Energy and Commerce Committee and the Ways and Means Committee, key committees of jurisdiction. 20 of those text bank parties have already happened. We've texted actually hundreds of thousands of voters because of those parties. We are running text bank parties pretty much indefinitely right now because they're so successful, and essentially we're identifying a huge army of supporters in districts of key committees of jurisdiction. So when a hearing comes down or a crucial decision comes down, we will have those army of supporters to essentially call on in a second. If you are interested in hosting a text bank party, please go to Medicare4all.org and sign up to do so. Again, just want to say we're so grateful to all of the activists on this call and all the organizations on this call who have helped make this August recess plan such a huge success so far. And now, of course, everybody knows it's the time to ramp up pressure. Presidential candidates are making the discussion around Medicare for All a household discussion. Medicare for All is getting lots of free airtime by the mere mention of it during the Democratic presidential debates. We need Congress to feel the pressure now and hit the ground running when they return in September. So please, if you're at all inspired or interested in this plan, check it out, Medicare4all.org to join us. Thanks so much for having us on the call.
Thank you, Kelly. And just to chime in behind you there, as we in PDA like to do, because you guys are such amazing leaders. I have never seen any other organization so willing to step up with the same strategy as PDA, which is both inside and outside the Democratic Party in particular. So, and never a lack of things to do if you follow the lead of the nurses on these actions. So thank you so much, Kelly, and thank you to NNU for all you're doing, of course. I think we're pretty good on schedule here, Melinda. So anyhow, at this point, it's my pleasure to bring up Chuck Pennacchio. Chuck, are you with us? I haven't seen Chuck. Have you?
Yes, I see Chuck is there. You need to unmute yourself, Chuck.
And then let me intro you, my friend.
Okay, is that good?
Hey, there he is. So for those who don't know Chuck Pennacchio, you should, because he's actually one of the featured testimonial givers. I would say stars, but you know, in the film Fix It Healthcare, you'll see Chuck along with so many others of our heroes like Wendell Potter and others. And Chuck has been a good friend to PDA for many years. We supported you in your race for the U.S. Senate, right, in Pennsylvania, and knew our old founder, Tim Carpenter. But of late, Chuck is running the group that we helped found some years ago called the One Payer States. And this is a group that's committed to sharing and exchanging best practices in the effort to get single payer universal health care at the state level all across the country. And of course, we know there's this intersection between what goes on at the state and federal that makes us so tied in. So, so it's a great pleasure to bring Chuck on the call and into the webinar once again. And Chuck, maybe you can give us an update on OPS. Thank you.
All right, Dr. Bill, and to the folks at Public Citizen, PDA, One Payer States is thrilled to be a part of this collaboration to get these resolutions through on Medicare for All. We're also focused on getting legislation to enable the states to move forward. Bill soon to be released by Representative Ro Khanna. Last year it was House Bill 6097 by Pramila Jayapal. This year it'll be Ro Khanna, and we anticipate that happening within the next few weeks here. We're at an extraordinary turning point in time with the state level single payer movement, and PDA has been critical to that. Any number of other organizations, state organizations that are very active. We have roughly 17 extremely active states and up to 25 represented states working on getting Medicare for All legislation passed at the state level. And we as an organization over the last several months have been in the process of furiously converting our energy and our, I guess you would say, our nascent organization into a thriving organization. We're converting into a 501c4 for purposes of engaging on this legislative activity. And we'll also follow on with the creation of a 501c3 so that we'll have an educational arm as well. So we're in the process, again, of getting ourselves up and running. We'll be part of the national organizations working on petition drives. And in particular, we're going to be focusing on, again, the state-based universal healthcare legislation. As an organization representing the states at the state level efforts, we also are focused here in Pennsylvania. I was asked to report a little bit on what's happening in Pennsylvania, is that we've got initiative efforts happening currently in Norristown and coming up here in Philadelphia and coming up in Reading to the north. So there's a lot of state activity. Just in the last election cycle, Pennsylvania was able to go from 5 elected Democrats to 9 in a class of 18 total congressional seats. So we see a lot of opportunity on the horizon, working together, getting this legislation passed. And the thing about one-payer states, the final thing I'll say is that we are opportunity focused. And we are looking at helping people at the local level, the state level, and the national level. Even though our focus primarily is at the state level, we work with our brothers and sisters at all levels to make sure that we get as much progress and traction as possible to see enactment of universal health care, single payer, Medicare for all legislation. So for further information, if folks are interested, go to onepayerstates.org, one states, STATES, one payer, PAYERSTATES.org for more information. We'd be thrilled to have you take a look at what we're doing, and as we are thrilled to be working with everyone here. Thanks so much, Public Citizen and Progressive Democrats of America and other partners in this effort. Thank you again.
Thank you, Chuck. Thanks so much. And we're right in there with you. So now we'd like to move to some PDA activists on the ground, and thank you so much, Medicare for All Resolutions, for accommodating our PDA activists from around the country. And I have two terrific friends to bring up here. We will just at random start with Mitchell Stolberg from Florida, Broward County PDA. So Mitchell, are you there? And can you update us?
I'm here.
From your corner.
Thank you, Dr. Bill.
Thank you.
Can everybody hear me?
Yes.
Yes, we can. Thanks, Mitchell.
Dr. Bill, Brittany, Melissa, everybody on the call, thank you very much for this opportunity. I just came from a meeting tonight as we, just before we joined, I joined in at 2 minutes before 9. It was a LGBT caucus meeting with both Debbie Wasserman Schultz and Ted Deutsch, our nemesis, down here in Broward County, Fort Lauderdale. And again, both of them are still working on ACA. No mention of Medicare for All. They're not so very supportive. They do support public option, but we will still keep plugging along. I go to every single meeting that he has, town halls. I sit in front. He knows me. That I'm sitting there. I have the Medicare for All signs, I have the impeach Trump signs, and I have the climate emergency sign, all three. I go through a shuffleboard, and he gets a big kick out of that. But unfortunately, he's not jumping on board with Medicare for All, and unfortunately, he didn't get to my question, and that was basically what is the reason that he was on Medicare for All 767 when the Republicans had the House, and now that the Democrats have the House, why isn't he not on Medicare for All? We still haven't gotten that answer from him. But what I'm doing down here in Broward County is I've already set up meetings and have been talking with local commissioners from 4 different cities, trying to get resolutions passed. Unfortunately, right now, they're all in summer vacation, so we're in a bit hiatus. I just had a meeting on Sunday with the national nurses and a roundtable for Medicare for All, what we're going to be doing. This coming Saturday, we'll be outside of Congresswoman Federica Wilson's office, doing a action thing for Medicare for All in front of her office. And I'm planning on Dr. Bill, get ready. I'm planning on a town hall meeting in the Oakland Park area, which is one of the cities that I'm working on mostly. I've already spoken to 3 commissioners there, and all 3 of them are on board for Medicare for All. So I'm looking for a positive result from that commission, because even if those 3 vote, it would be a 3-2 vote, which would still pass. So I'm looking forward to that. That's someone who is a staunch Medicare for All person for umpteen years, following Bernie Sanders in 1983. I am fully on board and do everything that I can to make sure that we get universal health care for everybody.
Awesome.
Thank you.
You are awesome. Thank you so much, Mitchell.
Thank you.
I love you, buddy. So now I'm happy to bring up Eve. Eve Shapiro, are you there?
I'm here. Can you hear me?
Hey, Eve, great to hear you and see you from Tucson, Arizona. A terrific old friend and a friend of PDA. Thanks. So what's going on in your corner of the
So
world?
I wanted to thank you all for having me on the call. And first I wanted to say that after the 2018 elections, we put together an amazing coalition with PDA, PNHP, of which I've been a longtime member, DSA, NNU, Labor, Lucha, which is a Hispanic organizing group. And we organized throughout the state. We met with our member of Congress, Ann Kirkpatrick, and she agreed to sign on to Medicare for All, which was kind of a shock to all of us. We are trying to get her to encourage her colleagues to do it as well. We continue to meet by Zoom every month with people from the rest of the state who are putting a lot of pressure on the members of Congress up there, the 2 Democrats, to try to get them to sign on as well by doing a lot of the things people mentioned on the call, going to town halls, any public events, and trying to put pressure on them. And so that coalition has been incredibly useful, and I just urge everyone to try to put coalitions together in your community as well. Once I saw about the resolution issue, I presented that to one of our city council members. Tucson is sort of a small, big city, so we kind of know everybody on the city council, and it makes it a lot easier. Plus, they're all Democrats, and the mayor is a Democrat. So they are going to probably do it as a consent agenda item because they don't expect any dissent in September. My only concern is the language they're going to use. I'm hoping they don't water it down too much because I gave them draft language. So we'll see how that goes, and I may be looking for some guidance on pushing back if they water it down too much. So we're hoping to get that passed next month and then use that to present it to the Phoenix City Council, which just got a new progressive elected, who can bring that issue forward in Phoenix. And hopefully that can put pressure on the members of Congress up there to sign on to Medicare for All. So that's what's happening in our state, and we keep meeting and trying to get all our, at least Democratic members of Congress on board.
Well, thank you, Eve. You're an inspiration to me, certainly for as long as we've known each other now, what, like a decade now, I think.
Yes, or
And-
more. It might be more.
And so thank you so much, Eve, and so great to hear all that you're doing, which is terrific. So I'd like to move now to Haley, right? Haley Mack from, is it Birmingham,
Yes.
Alabama, right? Haley,
It
thank you.
It
Thank
is,
you.
yes.
Please let us know what's going on with your group. Audio Audio is not clear.
Yeah, your audio isn't working.
Oh,
Okay, it had cut out. Is it any better now?
Yeah,
No?
yeah,
Yes.
it's better now.
Okay. Okay, great. It's been cutting out, and of course, it just did it as he introduced me, so I apologize. So I didn't hear how I was introduced there, but we have a resolution that is going to a subcommittee of the Birmingham City Council on Monday. And from what I understand, they're going to be using the draft that I gave them. So that's great. I'm trying to clarify if that's really the case at this point. If it does go through this committee, from what I understand, it will be on the consent agenda the following week. So I'm excited about that. One of the strategies that I am using here, especially after I delivered 700 signatures to Terry Sewell's office, and they looked absolutely bored, so completely unimpressed. I know that on one of the phone calls that I heard, there was a suggestion of doing postcards. So, so I have made postcards. So they're addressed to her, and then on the back they say why I support Medicare for All. And asking that Terry Sewell become co-sponsor of the bill. So that's something else we're doing. But the language I put in the resolved portion of the resolution is intended to hopefully bring her along, because she's very committed to the ACA. And so the language I inserted that wasn't in the toolkit was that that the City Council supports the ACA staying in effect until it is replaced, and also encourages the Alabama state legislature to go ahead and pass Medicaid expansion. Obviously, those monies are available immediately should we do that. And I also think that may be key to bringing some Democrats along, some that seem to think that there's a choice between ACA and Medicare for All. I'm hoping this will get people to see that that there are other ways to approach it.
absolutely. I love that approach. So thank you, Haley. That's a terrific report, and I'm so glad that you're doing that. Sorry.
Yeah, just bring in one other, and that is our follow-up to our People's Assembly is a rally that's going to be held on the 25th, on Sunday the 25th, and it's a healthcare is a human right rally, and it's in support of both Medicaid expansion and Medicare for All. So we're going to have about 24 speakers, and we'll have people in the audience supporting one proposal, the other or both. So thank you.
Awesome.
But it's really exciting to think about, Birmingham, Alabama is on Monday is going to have a committee meeting around Medicare for All, and we really are grateful. I want to just do a shout out. We also will be having all of the organizations that are part of this trying to mobilize members in each of these cities, like Norristown, like Birmingham, as they are coming up, to make calls to council members to show up to testify, and to try to help to get earned media around these resolutions. So this is a great way, as particularly for someone like Terry Sewell, for Representative Sewell, to see that to have the People's Assembly, to have the local officials coming out, so using all of these different tactics is really exciting to see, and we're really grateful for all the activism that's happening in those places. So thank you, Haley.
Thank you,
Thanks.
Haley. Thanks so much. Yes, well, in Costa Mesa, California, we'll be having a Solidaria event. Actually, we're going to tack a town hall at Representative Harley Ruda will be leading. So we're right there with you and the people assembled. So thank you. Do we have Stephanie on the line? Stephanie Nagayama?
So Stephanie from Healthcare Now unfortunately sent me a note saying she was stuck and was on a train and wasn't going to be able to make it. So she thought she might at the end, but I'll give the quick update, which from Healthcare Now, which is a really important partner in our resolutions effort as well, and have state coalitions all around the country as well. But Stephanie was going to share with us, and to make sure it's on everyone's radar, that they Healthcare Now and Labor Campaign for Single Payer are going to be hosting a single payer strategy conference on October 18th through the 20th in Portland, Oregon. And it's going to be a really important convening where we'll be talking about all these different tactics and really mobilizing, given this moment with the 2020 elections and Medicare for All being kind of having the heyday that it is having, for us to come together to really strategize together and to get ready for the fight again. So we will also paste into the chat the information on registration for that, and we'll make sure on a subsequent call that they also do that. Did I not? It's October 18th through the 20th. If I said that wrong, I apologize.
Right. And if I could just add to that, Melinda, that I have attended that. I know Chuck Pennacchio has attended, and others. The nurses have always a fantastic presence there at these annual national strategy conference for single payer. So it really is a phenomenal event to participate in. I highly recommend everybody do that who can make it there. It's in Portland this year. You actually see scenes of this. I'm sure Chuck would know this from his work with Richard Master, but you see scenes in one of the Fix-It healthcare movies, scenes where they're talking about a large group and unions and that kind of thing, participation, and you'll see a scene from one of those conferences with a huge hall filled with people, and I always say, there I am in the back. Did anyone see? So. But anyhow, by all means, join us at the National Single Payer Strategy Conference this year in Portland. And thank you so much, Healthcare Now and the Labor Campaign, our good friend Mark Dudzik from the Labor Campaign for Single Payer, and of course, One Payer States, who will be part of that strategy conference as well. So, what are we on to now? It looks like we're wrapping up, Melinda.
Yeah, well,
last minute.
Well, I also want to, we have a couple of minutes. If there are panelists who want to respond to any of the questions that have come up in the chat, we can do that. I do want to once again direct folks to the map. Well, there have been a couple maps that have been mentioned on this call. In terms of the resolutions, if you go to Medicare number 4 allresolutions.org, that's where you can find the map of, we have now 170 efforts underway around the country to pass resolutions, and our goal is really to get to hundreds of these, and we believe we can do that. This is a strategy that works in red districts and blue districts and purple districts, where you can if your member of Congress is hostile to Medicare for All, this is something that you can do. If your member has already signed on, it's still something that you can do to keep the drumbeat going. And for these hard to get members who are on the fence, this is a great way to build a movement, to win a victory along the way. And so we encourage you to go to that map, and you can sign up to join an effort that's already underway. Some of these need more people, and the more people that get involved, the easier load it is for each person who's engaged, and it can be fun. And I'm really inspired to hear from the activists who are doing this, and that's what we really like to highlight in these webinars. So if you are engaging, if you would like to present about the work that you're doing locally on our next webinar, please do so. You can email us, you can put it in the chat if you're interested. Brittany will put her email address in the chat so you can be in touch with her. We will have another webinar on September 5th for the Medicare for All Resolutions campaign. So September 5th at 8 p.m. Central, 5 p.m. Pacific, which we will make available for everyone. So if there are other panelists who would like to address any of the questions or have any closing thoughts, we're getting close to the hour, and I want to thank everybody for your attention. We've had great participation from all around the country, and for folks who haven't, who weren't here right on the beginning, we had 70 folks together watching this webinar in Montana in a big auditorium. So that's just one example of the excitement that we're getting from large cities, small towns, all around the country.
Thank you. Yes, Brittany, Melinda and Brittany, thank you so much for your work there. There is kind of an ongoing discussion in the chat here about the costs and the role, if there will be one, for private insurance and that kind of thing. It's obviously more than we can talk about in a few minutes on this in this meeting, but the Fix It Healthcare group, through the publication of their movies, especially Wendell Potter's group, I'm blanking on the name, Tarbell, also has done a whole lot of this kind of policy discussion. I know that Chuck in the One Pair States and also the National Coalition have had communications discussions too, in terms of how best to communicate these things. But I would encourage you to contact any or all of those groups if you'd like some help with that kind of the talking points and communication points on those.
And Bill, could I just add something? I think the PNHP website, PNHP.org, has a lot of really good information about costs and a lot of evidence-based detailed information that can be very useful.
Thank you so much.
That is true. I just saw that Sanaa Abrar from United We Dream, who was one of our panelists and wasn't on earlier, has joined us. So Sanaa, if you would like to say a few words. Oh, no, I think she just dropped off. Oh, no.
I just thought. There she is.
Oh, there she is. Hi, Sanaa.
Your audio is on mute.
You're on mute. If you let me see if we can unmute you. If you'd like to say a few words, United We Dream is a new partner in our Medicare for All Resolutions effort, and we're really excited to be partnering with United We Dream and making the links with immigrant justice. So as we're closing, if you'd like to say a few words, Sanaa, we'd love to hear from you.
Sure, thank you. It's very gracious of you for allowing me to speak just for a minute or two. I'm very sorry I was late to this call. I want to stress just how important it is that this movement of folks who are all about healthcare for all, regardless of status, regardless of background, has been energized by people like you, the panelists here, as well as the attendees here and beyond. I represent United We Dream. We are the nation's largest immigrant youth network. We're really excited to join in as partners, as continuing endorsers of Medicare for All. I, again, can't stress how important it is that we are seeing local elected officials all across the country taking a stand for Medicare for All, because for us, it hits home personally, particularly because many of you all know undocumented immigrants do not have access to much of healthcare in this country unless it is for emergencies. We know and believe that when it comes to healthcare, it should not just be about emergencies. It should be about prevention, about mental health, about access to abortion. And there are very few and not very accessible clinics that do not discriminate on the basis of status, but there just aren't enough. So this is huge for our communities, particularly for members of our communities who have unfortunately had to either drop school, take on extra jobs in order to pay for their loved ones' healthcare, for their loved ones' medications, and unfortunately, in some of the most tragic cases, seeing their loved ones pass away or deal with chronic medical issues as a result of just not being able to access healthcare that many individuals in this country, as a result of having papers, as a result of being documented, do have access to. So again, we in the immigrant rights movement are continuing not only just to be in solidarity with this work, but we are impacted, and we are so excited to continue pushing out this important message, and beyond that, to push for healthcare for all, because so thank you so much.
Thank you so much, Sanaa. And it's really important for the healthcare justice movement to be showing up for immigrants right now, particularly at this moment in our nation's history with the attacks that are happening. And so we are with you.
A healthcare injustice to anyone is a healthcare injustice to everyone.
Yes, that is correct.
If I could say something on that, possibly. This is Mitchell Stolberg.
Sure.
I did a government academy, which takes you around to all the departments within a city, whether it be fire department, police department, waterworks, the whole 9 yards. And at that time in 2010, it was reported by our fire chief, and this is something that you can use when you're talking to your city commissioners and your city council people. Built into the budget is a 6 to 10% loss for the fire department when they're collecting their bills for insurance when they go out to an auto accident for people that don't have insurance, when they go out and pick up the homeless when they have no health care insurance. They're losing money every time that happens. So when an immigrant or who doesn't have insurance, if we're not allowing the coverage of these of all people, they're losing money, and it's costing the city. And that's something that needs to be pointed out to the city, that if we had Medicare for all and we covered every person in the country, we wouldn't have that problem. You wouldn't be operating at a loss.
That's right. Thank you, Mitchell.
Well, great. I think, so we are past the hour, and I want to respect everyone's time. It is late, certainly on the East Coast. I want to thank everyone for your participation. We had fantastic participation from around the country. This movement is about all of us, and it's about all of the local efforts that are happening. I do encourage you to check out the map to get involved. If your town is not on the map yet, we have all the tools that you need to get started. There's the toolkit on the Medicare for All Resolutions.org website, step by step. Brittany is here to help as well, and the large coalition, including PDA, NNU, and all of the other organizations that have made up this. So we're really excited. Our next webinar for resolutions will be on September 5th, and the next PDA webinar, our conference call will be on September 11th. So we will be in touch, and thank you all for all your participation, and have a great evening.
Thank you, Melinda.
Thank you.
Thanks.
Bye, everyone.